Healthcare is changing, and in Biñan, Laguna, one clinic is raising the bar by merging medicine with lifestyle. Groundbreaking facilities providing advanced wellness. It is redefining what a wellness hub can be. We go behind the business of experience in premium healthcare with Dr. Joseph Lee and the Rejuvenative and Aesthetic Wellness Center.
The whole hub tends to make a relaxing feeling for our male patients so that when they have their treatment and they're finished, they're happy.
We are now open for business.
It is a signal to the world. We are open for business.
Tonight, we explore how healthcare is expanding beyond the traditional consultation room. In Biñan, Laguna, a 4-story wellness center is offering not only specialized medical services, including the first state-of-the-art machine for the treatment of erectile dysfunction, but also spaces for art and relaxation. It's an ambitious business model blending health, lifestyle, and hospitality. And it is being positioned as the South's first premium male wellness hub. Joining us is Dr. Joseph Lee, urologist par excellence, who will share the vision, strategy, and opportunities behind this innovative approach. He is also the CEO, the founder of Rejuvenative and Aesthetic Wellness Center. How are you, Doc Joseph? Kumusta po kayo?
Good day, CRV. And of course, thank you for such a pleasurable invitation in your show, Open for Business.
Our topic is really very exciting, and at the same time, it's a bit sensitive to a lot of males. It's sensitive to the Philippine society as well, diba? And for some people, this is taboo. Discussion of this is taboo. It's not normally discussed in the public or even in the, you can only do this in the confines of your private gatherings with families or and close friends. But this is something that's really revolutionary because this is the very first male wellness hub. At marami akong tanong tungkol dyan. Pero bago ko tanungin ang mga yan,
Okay.
may research kami, Doc Joseph, na yun daw prevalence or yung presence ng erectile dysfunction sa Filipinos, according to a clinic-based study, maliit lang, 10.4%. Pero kapag daw community and informal or online studies na, mas mataas, 66 to 79%. Bakit ganun? Bakit ang laki ng diferensya or paiba-iba yung data?
Men tend to think about it, or the society, or even the community think about it as a taboo. But the problem has been existing for longer periods, as what you have said, that it has been in the clinics. And most of the time, the problem tends to be inserted on another more serious problem. When I say more serious problem, when patients would come to us and see us, it's a matter of talking about prostate problem, kidney problems, stone problems, infection, and the insertion will come later on the last part of your history taking with your patients, wherein most of the time they call it pahabol. Doc, pwede ba bang additional? The history of erectile dysfunction becomes a more curious but becomes serious on a final consultation of the patient because of the insertion.
Pero bakit ganun, Doc? Parang, is it because it's something that males or the society is ashamed of? Ano ba ang edad na dumarating na ang mga kalalakihan pagdating sa ganitong estado?
This is long overdue because of education. When you say education, men are learning what is erectile dysfunction, what is the cause of erectile dysfunction, and there is no shame talking about erectile dysfunction.
Yes.
Because if you talk about a person or a patient that is isolated in a clinic talking about that, sometimes they do not really brag about that when they go out. Parang feeling nila, CRB, parang ako lang yata may problema at I'm voicing it out, okay? Nobody in the society or the community might even talk about it. So the taboo becomes another problem that is subconsciously being hidden by the person because there is already a problem, and that can lead to a more chronic problems later on. When you see it now, there are many patients coming in with age group of 50 and above, or even 30 to 40, wherein they have transient erectile dysfunction, not really the organic type of erectile dysfunction.
Doc Joseph, in as much as you mentioned about the other serious illnesses, gaano ba ito kalala? And sabi po nga, this is just an insertion. Doc Joseph, parang napapanahon kasi maraming parang insertion ngayon sa budget. Di ba? Parang ganyan. So parang ito, alam mong malala, pero in-insert mo lang, pero napakahalaga.
So
di
you
ba?
know, di ba?
Sige.
Tama ka, sabi mo nga CRB, napapanahon, which is really true, di ba? So when you talk about insertion in the medical field, especially in this disease itself, it becomes very realistically true.
Parang ang daming risk factors ngayon. So ano-ano ba to? At gaano kalala ang not only erectile dysfunction but maybe the other male-related illnesses or diseases. So going back to all these risk factors, di ba, we have the age, hypertension, central obesity, diabetes, smoking, at inactivity, di ba? Pag wala kang ginagawa, di ba? These are the major risk factors. Pero in terms of the gravity of this problem, parang kasi the fact that you created the first male wellness hub, it is something serious.
This has brought me to create the male wellness hub, right? So when we talk about erectile dysfunction, we delineated or divided into the organic type and the one that is psychological or psychogenic in nature. When you talk about the organic type, this is the ones that you mentioned a while ago, the hypertensive, diabetic, metabolic syndrome, the ones that are obese, the abdominal girth, those who are experiencing andropause, male menopause. We have male menopause, if you have to know that. Okay, so these are aging. These are aging men.
Pero pag ilang taon yun yung andropause?
These are 50 years old and above. So you have those organic. So organic types of erectile dysfunction, naturally, they will end up having the inability to have good erection. Okay, the ones that we're having problems right now, okay, and we're having increases in numbers are the ones that are psychological and stress-related erectile dysfunction. Okay, these are related to anxiety, depression, mental unconsciousness, medications for young individuals. They're not only young individuals, but these are pertaining to age 30 to 40, 40 to 50. So they haven't even reached the age of male or men aging. So
Wala pa sila sa prime.
wala
kumbaga.
pa sila sa prime. And when I see them, nagugulat ako, parang you're 20, you're 30, and you're having already problems, okay? So this should not be the case, and the incident should not be. Are we talking about isolated case? No, these are not isolated case. When I see cases like this, even during pandemic, post-pandemic, so this is troubling. And I cannot say that giving medications or oral medications that we have available for erectile dysfunction to be consumed for individuals who are 30 to 40 years old. Diba? Parang feeling ko it's uncomfortable for me for practicing, for such a long. Parang, oh, you're 35 years old, you do not have erection, we give you something, like sildenafil, okay ka na. And that is not a practice that we want to do and happen. Because for me kasi, you're a young chap. Pag 50, 60, okay na yun, di ba? Naiintindihan natin CRV, pero 30, 40, what if these individuals that I see in my clinics, some of them are not even married? Okay? So you'll have problems later on to marital affairs, di ba?
Like say for example, one of the reasons you mentioned, Doc, is psychological. Siyempre, iba yung treatment doon, di ba?
Yes.
And also you mentioned depression, di ba? What are the modalities? So siyempre, iba-ibang klaseng
Exactly.
treatment yun.
Yeah.
That's why consultation is very
Right.
important.
Consultation is very important. You're saying, do we have mechanism in order to check? Of course, we are guided by history. We are guided by grading system. We are guided by Doppler, penile Doppler, to check the blood flow and everything. What if this becomes normal? But the patient who is a bit on the middle age claims to have problems with ED. So it's what we're talking about now. It becomes a inserted disease symptoms wherein there is problem. So what do we need to do? We have to bring it back to its basic normal form of the natural course of the stimulation, the hormones, the nerves, the brain telling you that I'm satisfied and we need a process of erection.
Assuming this is not treated, kunyari, nahihiya ka talaga kasi the Philippines is a macho society, di ba? Parang ikaw yung siga, ikaw yung lalaki. What if you tend to ignore it? Ano ba yung consequence?
It will become a chronic phase and it becomes pathological. When we say pathological, there is already an existing disease. Erectile dysfunction. Like if you're organic, meaning you have diabetes, hypertension, and other medications being taken, you have CNS problems and all those stuff, your stroke, you'll end up having probably erectile dysfunction. Then it becomes pathological. So talagang meron cause. Now, what we're saying is if it persists and it's coming from physiological. When you say physiological, stress lang eh, anxiety lang eh, depression eh, pagod ka lang eh. So there is no turncoat of really going into the ED itself, the natural ED. It's just because you're tired because the natural hormones of our body will react to that. Pagod, paano ka magkakaroon ng stimulation? But if you constantly have that in the nature, it will become permanent, so it becomes chronic in the sense, and it becomes truly pathologic. So magkakaroon talaga ng disease effect. Yung physiologic na dapat makorek natin, it becomes really, really permanent.
Ay di ba itong mga problema naman to, available naman yan sa pwede mo naman makuha sa urologist, marami naman clinic dyan. All the services that we are talking about are, can be discussed in the hospital and in regular clinics. So, bakit ka nagtayo ng wellness center?
That's true, no? You can talk about this within the room or your consultation room in your hospital. But not all hospital will be really open about in bringing machines that will help innovate the erectile dysfunction, right? So I think that's one factor to add. The machines not yet available in the Philippines. You propose it to the hospitals that you work it, even if you are on high position, there will be a lot of interplay and a lot of discussions and a lot of and debates. So I took it upon myself to bring and put up a male wellness hub, specifically to shelter or put in the machines that I've seen, that I've trained in Europe. And I thought about it and said, why are they using it? Why are they doing it? Why can't the Filipinos have the taste of innovation
and take advantage of it as well?
And it's not really surgical. It's non-invasive that we can have. And with the growing problems of erectile dysfunction, and when I saw what we are explaining a while ago, so why not? It's a big checklist for me that I have to bring something to innovate, and it's actually aligned to my specialty.
The Philippine scenario compared to, sabihin na natin, Asian countries, malala din ba yung sa atin? Or kumbaga, tayo okay pa? Or dahil conservative ang families natin, mas malala sa atin at mas the reason why these machines are available in other parts of the world because they're very open about it, 'di ba? It's not taboo to them, 'di ba?
In our setup kasi we are pharma inclined.
Okay.
Okay, so we are friendly to pharma. So whoever is pioneer and who instituted the drugs that I've started to improve yung erectile dysfunction, some are very attached to them. So when you're attached to them, this innovation, especially that are non-invasive machines, are a no-no for them.
Okay.
Okay.
Yes.
Was I bold? Probably. Was I doing it for myself? None. But probably for individuals who wanted to have other management mode, because I have patients who have come and told me that, Doc, I've served myself, I've taken this one, I've injected this one.
Wala
It
pa rin.
doesn't work. Oh, so how many of them have been telling it to me? And they need to go abroad to find solace and to have themselves treated. So when I was addressed to that scenario and situation, sabi ko, then I had to bring one here and use it for our kababayan Filipinos.
So dapat pala magpasalamat tayo kay Doc Joseph kasi I agree that is a bold move and
Yes.
pero ngayon ba Doc kasi somehow you are disrupting the industry, di ba?
Yes.
Siyempre pag dinidisrupt mo yung industry parang wala ka bang diyan, wala bang nakakalaban ka naman ng mga pharma or doktor or baka baliktad, baka they will support you more, because of this initiative.
Right. What's funny, it's they tend to now to gravitate to me and want to collaborate. Collaboration is good, but the thing is, they still want to, alam mo, the word insertion is still very,
Uso talaga,
pinapasok yung gamot.
Oo.
Parang sinasabi nila si RV, parang, baka pwedeng ilagay mo rin sa protocol mo. You have the treatment, doc, baka pwedeng, post-op. Oh, they tend to have that. Because when you see the protocol of the management of the machines, there is inclusive of still a lower dose of some of the pharma drugs.
I see.
Yes.
So parang at least ngayon, Doc Joseph, parang what you are giving parang is a more affordable opportunity for Filipinos.
Yes.
Diba? There might be other options, but this is something non-invasive. Correct? Okay. Some of the traditional hospitals already address men's health issues, but you've chosen to build a specialized stand-alone hub. In terms of treatment, what men's health concerns do you address in the center?
Okay. How many, I think you visited hospital, even
Many times.
the very nice hospital we
Yes.
have. Have you seen men's?
And I've worked in one of them,
Yes.
di ba?
Have you seen men's wellness
May
center?
women's. At saka,
May women's, pero walang men's
Oo.
wellness center.
Wala. Oo, tama.
Di ba? True. Have you
Tama.
seen?
Oo.
Di ba? I've already told even some of my the hospital that I work in, can the men's wellness join the women's? Paano yun? Talagang dinidikit talaga. Women's meron, di ba? Breast cancer center, may mga ganon.
meron.
Pero walang men's wellness. They still isolated and put it into some enclosed consultation room. Just talk to your doctor, and that's part and parcel of a urological consultation. So men tends to look at it as parang taboo, shameful when I go here. When there would be a male wellness center, ang unang isip hindi prostate IED. Pero if you're talking about a patient who is bold enough to go, paglabas nila, baka pag-chismisan sila, ganon, di ba? So ayaw nila. Like what you said, it's a very machismo thing for the Filipinos. So that is the one that I isolated it and put it somewhere else. Not really way far, para at least people who wants, or patients who wants private, but they have problems, can go to that hub and tell themselves, nobody can tell me that, or nobody can shame me when I go to this center. Sabi, oy, ED ang patitit mo, ha? Di ba ganon? Wala. Oo. It's just a thing that it's like for us, built for us, and we male patients will just complexly and communicate that we know for the fact we have all the same problem.
Earlier, you mentioned about this stigma or discomfort, and the reason why you place it somewhere in the south, not in the metro, is you want, as you mentioned, you wanted to create that privacy, exclusivity, di ba? Ngayon po ba, sa tingin mo, nag-iiba na rin yung perception, or are you still talaga in the education phase that, you really have to tell them that, it's not, it's normal now to talk about that treatment?
The education phase, it's still there. We're doing it, even me, several times been a resource person for some channels to talk about it, okay? There are reservations to some male patients, okay? Would you say that this is something that is carefree and can bring patients to come? I think so. This is a challenge, but the challenge has to be very significantly move forward because like what you say, CRV, pag hindi mo gagawin, like in business, no? We're not in business. If you don't do the challenge, what for? Diba? So you have to approach it with an open mind and an open heart that people will come. If you have the problem and if you're ashamed, if you don't want to go to the hospital, there's a center for you that you will love, and of course, your condition will be cured.
Now, before you walk me through, to this four-story edifice, pag sinabi mo bang health issues ng males, ano ba yung karaniwan na mga sakit? So, unahin natin. Ang alam na alam lang ng mga tao ay prostate cancer, ED or erectile dysfunction. If you can give me our audience, ano ba yung makaraniwan na para sila, pag pumunta sila sa the first male wellness center, isahan na lang yan. Okay. Sige.
Diba, you've seen it, CRV, the optics of it, the ocular, okay, when you see the building is like a four-story edifice. So when patients will go there, male patients will go there, hindi siya hospital. Kasi when somebody would refer you, sasabihin, bakit mo dinala ako sa parang bahay? Kasi pag hospital, takot na siya. Diba? They're scared of hospital. They're
even
scared.
the smell of it.
Even, and when male will look at it and they will say, who will look at me? Who will do the treatment? Is it a male nurse, a female nurse? There's a lot of questions already. So that is why the structure is made very homey. Okay. Now, when you look at it inside, there are a bit of aesthetics. So we put sculptures, painting. This is to calm individuals because they say that arts are very calming. It gives neuromodular enhancement. So patients will feel that, oh, I will get well here. Because it doesn't have smell like formalin or those betadine, yung mga ganon. Pag unang tingin mo, di ba,
parang even alcohol.
Alcohol. Di ba? Anong gagawin sa akin? Kasi then they will ask, this might not be non-invasive. They will do surgical thing to me. Okay? So we follow through the levels of the center. The ground floor is where the clinic and the treatment room is. So why is it set up like that? Kung natakot ka, pwede ka lumabas. Kasi di ba, hindi, run for your life, di ba? Usually kasi pa sa hospital, men are scared of hospitals. Men are scared of needles. Men are scared of a lot of things.
That is true.
But they're not scared of beautiful nurses.
Yes.
Right? Medyo alalayan mo ko. So if you don't, you can leave. Okay. So when you look at it, the way you were asking me, why is the patient lounge or wherein the patients will stay on the second floor? So they're more comfortable. It gives an ease and to think about if they really want to do the treatment. So there is a way of parang, okay pa ba?
You are giving them an easy exit strategy.
Right.
An exit plan.
Right. But if you like, if you're comfortable, if you're relaxed, then you do it.
Okay.
Okay. And the other structure, like it is aesthetically combined with art because it says that medicine is an art, it's a science. So the art calms you down, brings down the nerve, the anxiousness, even the cortisol. I remember the stress can taper down because you see artworks there. Diba? When you look at it, diba, CRV, parang, ay, bakit may artwork? Hindi naman yan for showing off, but it calms you down.
Yeah.
Wala akong nakikitang mga surgical picture, yung mga inopera dito,
correct.
'di ba? Sa hospital maraming
correct.
ganyan. 'Di ba? Maraming chart
Yes.
regarding cancer, gano'n. Upo ka, nag-aantay ka sa doktor.
Parang somehow, parang there's a lot
kabang-kaba
of,
ka na.
and you tend to have this information overload, you know, on all the
Exactly.
materials that you see.
Right.
You know,
So,
medical terms that, you know, somehow
yes,
intimidate you more.
exactly.
Diba?
So the whole structure, the whole hub tends to make a relaxing feeling for our male patients, so that when they have their treatment and they're finished, they're happy, because that's the sole vision, is to make men happy when they leave the center.
It is a male wellness hub, but what if I bring my wife with me? You know, my sister will join me as well. Are there also spaces?
Yes, they can join, and they can be entertained, and they will be educated on somehow. Like what you mentioned a while ago, I forgot to talk about it. Other diseases than the erectile dysfunction. You have the machine can treat premature ejaculation.
Okay.
The Peyronie's, which is a very new term, not really being used. Peyronie's is curvature of the penile shaft. Then there's another one that is not being talked about, is your Mondor's disease. Mondor's
naman
disease
yun?
is
Ano
like
yung Mondor? No.
parang varicose vein over and above the penile shaft.
Okay.
So the machine now improves the vessel flow, and to prevent further increase in the dilatations of the vessel. So the machines that we have, what we have and what you've seen, is to improve the vessel flow of the penile shaft and improve the sensitivity of your penile shaft, which has stopped because of certain, stressors, anxiety, medications and the like.
But Doc, this is on top of the regular specialization that you have.
Exactly. So
diba?
pwede pa rin, sir, yung mga UTI, prostate, because it's still a urological
Which is
clinic.
exactly your specialization.
Exactly. The only difference it just houses a specialized machine for a more specialized disease entity with regards to your urological condition.
I noticed there's a lot of artworks there. There's a lot of, it's really a collection. It's like, I remember the medical director of St. Luke's before, that's Dr. Kwanang,
Kwanang.
diba? He owns Pinto, I
Yes,
think.
yes.
I think, but it also deserves to be tourism spot. A lot of people now are promoting even this. I interviewed the Secretary of Tourism here, and I also interviewed the Secretary of the Department of Trade and Industry, and both of them are promoting medical tourism. Your male wellness hub could be a destination because I've seen, your art collection. Ang tanong ko dun is, talagang, did you do that because art is also your passion? Or is there a study between art and the urologic problems? Or
Actually, CRV, there are stories between those artworks and sculptures, right? For the last 25 years of my practice, the art became hobby. But initially, it was not, because the first few collections that I had, they were given by my patients who traded their financial TF with art Okay,
Wow.
so some of them were trade. Naging trader ako tuloy. So I allowed that. Sabi ko, okay, you give me. So I never knew those artwork will become amazing later on in life. No?
But you did not do that in purpose. It's just that they don't necessarily have cash. Parang sabi niya, can I just pay you painting? Parang ganyan, di ba?
Okay lang ba daw? Can we trade it with your painting? Ano, sige lang, kahit ano na lang. So you do it because you're a doctor, you do your service, your health service. No? But you never knew that they're gonna bring this stuff of...
Solo na pala yun. One low na pala yun.
Right. And the rest of the others that you've seen are from friends that I've met, and they have networked me to other art enthusiasts. So, nagbigay. So, dumami, nag-multiply. When you look at it, it's very nice to see because my network of those who have been into the art has blossomed from sculptors, from bronze to wood, and all those stuff.
It's beautiful, Doc Joseph. I've seen it and parang you would really be wowed. It's not only a wellness hub to me, it's like a legitimate art gallery. Diba? So my question there is, I think there is, parang you applied the art and science also of balancing, diba, your health services with lifestyle and aesthetic components. Was it designed that way? Did you have an interior designer, or parang when you created this 4-story edifice, talagang iniisip mo na this is not your typical clinic or center. This is something different. Has this been part of your vision ever since?
Actually, the vision of doing a male wellness hub has been there ever since when I was on my early practice, but never as bold as this one. If I will do a hub, it should be different. When I will do a center, it should be something that my patients will be relaxed. With regards to the collections that you were saying, I want to share them. I want to share because what I foresee with the male hub is so that my patients will be completely cured, not only scientifically, but with regards to the aspect of the emotions, mindset that whatever happens, there are still things that we can do. Science can still help you. This is not the end of the thing, So that's it, right?
Wow, impressive. You're a doctor, Dr. Joseph, but talaga bang di ba, parang sinasabi nila music heals. Pero talagang, di ba may sinasabi din, narinig din tayo na art heals.
Yeah,
di ba?
art heals.
Art heals. Meron bang scientific study yon? O parang may
Yes, I
backup
think,
yun?
yes. So even they say, CRV, that music can tame you, then calm you, even artworks. No, less of the artwork itself. I think even colors can be something very therapeutic. When you look at the colors, it's very toned down. It's not strikingly bright because when you have very strikingly colored, diba, your emotion starts to aggravate, diba? Pag galit ka, nakita ka pulang-pula, galit na galit ka ulit, diba? Or if you have greens or pastel, you tend to tone down and relax because they say that artworks, things that you put in your center or hospital, has to be something that will stabilize your emotions.
Or uplift the spirit.
I think there are a few hospitals now, even our famous ones,
Yes,
they have
correct.
paintings and artwork. So, and they are positioned wherein patients are sitting.
Yeah.
Diba? Sa lobby. Kasi when you wait for your doctors, bago ka mainis, nakatingin ka na doon sa artwork. Naka-calm down ka.
Yeah. But Doc, there's one area in which is my favorite in your wellness center, the one that looks like an art gallery.
The third floor.
It also looks like an events place.
Yes.
So do you also plan to maybe welcome other organizations, maybe companies to do their meetings there?
Exactly.
Or any interviews or sometimes performances?
That's why the third floor, the one that you saw, was created for those who wants to have business meetings, focus meetings, they have to short talks. They can do it. They can borrow it or rent it because sometimes some of the restaurants or places are fully booked. Tapos, lagi sinasabi, naririnig nila, wala namang ambience. Di ba? Hindi naman maganda. Di ba? Ang mahal-mahal sinisingil. So, that's the way that I was thinking na, I'll give you the ambience. Let's just put in some of the things that you want to do, and voila, that's the place that we can see. Diba?
I think as we speak now, you're looking at the videos of the Wellness Hub. For sure, when you look at it in person, every corner is an Instagrammable corner. How do you integrate, the wellness center with the broader system? I'm sure there's, people would present their PhilHealth, insurance, HMOs, diba? Will you somehow collaborate with this, and are you open to these expansions so that, more people will avail of the services of the center?
Actually, this is a very interesting question, CRV, because I've thought about this. And during my practice, this has been a problem, a serious problem, especially with our HMOs or some of our packages, okay, because some of them are not really totally given to our patients. I don't know if it's short change or ayaw lang ibigay, di ba? So even workup, blood exam and everything. So instead of doing that, the center can give you reductions and very sensible package, which sometimes you will be at odd and say, ay, mura pala. Then even if we follow the European package of sessions, that they will say that, you have to complete the payment. We allow them per treatment payments. So that
Not
it's
necessarily pay in full.
Right. This is actually suitable for the Filipinos. So that's why this is created para comfortable ka. If you look at it, most of the time, it's a new machine. Anong iniisip natin, CRV? Mahal. Ayaw ko pumasok. Gusto ko siya. But I give you this offer that it's not mahal. You can have it. You can improve. You can get well. And you'll be happy.
Wow, that's great news. And to our viewers, convenience, privacy, and premium service is not necessarily expensive. Kaya parang, okay, so abangan natin, and hopefully, you visit the wellness center. This is unusual for a medical center that it's in Biñan, Laguna, and that I know there might be questions na magtatayo ka rin ba sa Metro Manila, di ba? Kasi hahanapin na yan. I'm sure, after watching Open for Business and, looking at the B-rolls, of the footages, parang they will go to you, which is good. Because I went there, it didn't take me that long, to go there. But are there plans also? I know that eventually you will grace Open for Business again to talk about your new branches, but do you have plans as early as now to having other branches?
Actually, CRV, this is very unusual because they used to say, you're a doctor entrepreneur. I'm never into entrepreneur, but my family tree, they're all into business. Probably I got the blood to do business in itself, no? But with your question is, there are people who have talked to me and suggested that can they partner with me and do one? There's one who's talking with me in, most of them are in the South. I'm very interested in the South, like the Visayas and Mindanao, and one in the North. But these are all in the talking table yet, but it's very interesting. Why not the Metro? You will say, why not the Metro, the main? That's why ang daming hospital, di ba? What am I saying, di ba? They should be on forefront and bringing the machine. Di ba?
Yes, correct.
It's a turncoat because why are the people or those who want to partner with me are from the South, from Visayas, and up the North. You will be amazed. So is that the need for people? Yes. Meaning, I think we should be open now to doing more new innovations. And not because we are chained to some other stuff that are difficult for us to move forward and have it, When you realize that this mail hub, I am the sole proprietor.
Wow.
Very bold.
Yes.
Wala
But-
akong kapartner.
Yes, but Doc Joseph, you mentioned about family earlier. Aside from, because you mentioned your brother is
Yes,
your
yes.
interior
COO,
designer.
yeah.
Aside from him, are there other inspirations from the members of your family when you created this?
Actually, the lot is from my late younger brother who have visioned this before. He always tell me, Kuya, you're working so hard, so when you retire, can you make a clinic here? It was my 83 years old mother you met that wanted, so wag ka na maggawa clinic. You make a full center wherein you can have something that you really want that is not available in the hospital that you are doing your visiting consultation. So that is why the ED center was created.
So, Doc Joseph, parang can you say that this somehow,
It's a family thing.
this somehow crystallizes the legacy of your family?
Each and every one of them. So that's why it makes it more fruitful, but not into the business sense, because the dreams and goals of my family are webbed into the center itself.
You mentioned about this, doctor entrepreneur thing. If you were given the choice, parang would you choose being a doctor or being an entrepreneur?
I'll still be choosing being a doctor. I think the audacity to really recommit and make something that will be of good to the service of your patients or client, diba? Lagi namin sinasabi ngayon CRV na parang, how did we make this, diba? I'm not a businessman. I can be bullied by contractors. Oh, ayan na naman. Diba? So it was on time. You were asking me, it was
Yeah.
on time.
It was built in 2 years, you
in
said,
2
or more,
years,
or more.
things can go on a different sideways. So, but what I say is like, whatever is given to me, I think we have to make it really work. Can you imagine this machine came from Europe? You will have problems with customs, diba? Everything.
yeah.
And this is the first in the Philippines. The manufacturer of this, they might not want to give it to you. Remember? So they trusted me na sabi, yeah, good. We wanted your advocacy, so go ahead. And of course, family, and of course, friends, and of course, like you, who is helping me, I think this will achieve into greater heights.
But Dr. Joseph, what are the contributions or what are the factors or characteristics of you being a doctor that helped you being an entrepreneur?
Empathy and commitment. Because when I commit, I really pursue. And there is a certain responsibility on doing that as a specialist. And you have to have that broader sense of empathy in doing it. So this is not about enriching and doing business. Of course, there is business inside, but you look at it in the forefront that you want to give something that is not available here. You just see it abroad for our Filipino.
Wow, those are beautiful words from Dr. Joseph Lee, the CEO and founder of Rejuvenative and Aesthetic Wellness Center. But before you go, Dr. Joseph, where can they find you? Are you on Facebook? And what's the address for people who would want to experience both the aesthetics and the pleasure, the wellness that this wellness center for males can deliver? Where can they find you online and in Biñan?
Rejuvenative and Aesthetic Wellness Center is seated at the One Asia Business Center. It is in Biñan, Laguna. You can Google it, you can Waze it. We have Facebook, Instagram, TikTok. I invite you all to experience the center, especially for our men having problems and who wants privacy.
Our buzzword of the week is integrative medicine. Uses an evidence-based approach to treat the whole person. It integrates conventional approaches and complementary therapies to achieve optimal health and healing. Wellness today is no longer confined to medicine alone, as we've seen the design of a clinic, the services it offers, and even the spaces they create all shape the way people experience care. The important reminder is this: whatever your health concern may be, consult qualified professionals and seek trusted centers. Wellness is an investment worth doing right. And with that, our quote for the week is from Ed Nordstrom. He said, "It's no coincidence that 4 of the 6 letters in health are heal." Maraming salamat, Doc Joseph. Maraming salamat sa isang oras na pagsama sa amin upang tunghayan ang isang makabuluhang usapan ukol sa negosyo dito lang sa Open for Business. Hanggang sa susunod na linggo, samahan nyo kaming muli dito sa Open for Business. Catch us too on Facebook and YouTube. Like and subscribe on our social media page at Net25 TV. We will bring you more insights from industry experts, thought leaders, CEOs, and featured SMEs. Together, let us help encourage business development in the Philippines. Sharpen your business acumen, feel the pulse, and set the trend for as long as you're informed and open for business. Ito po si Cesar Vallejos. Maraming salamat.